Hello all, this is Dr. Sue from Purely Pediatrics. Thank you so much for continuing on with us as we continue with our content that is posted weekly on our YouTube channel. So for this week, I would like to talk about pink eye. The formal diagnostic term that we use in the medical world is conjunctivitis, which means inflammation of the conjunctiva, which is that thin covering that you can see at the areas of the eye that are near the eyelids. So if you pull that lower eyelid down, you will find that that will look bright red, that more so than it normally does. Generally, it's a nice kind of a light pink color, but when we have inflammation of that conjunctiva, then it can get quite red and irritated. The sclera of the eye, which is the white part of the eye around the pupil and the iris, can also get what we call injected. Injected just means that the vessels, the capillaries within that eye area tend to get blood-filled and inflamed. And the reason this happens is because if you recall, viruses love to cause inflammation. And different viruses can affect different areas of the body. So inflammation in general is what causes generally almost every viral symptom that we experience, from cold symptoms to tummy symptoms, and eye drainage and redness with discomfort is also considered part of viral inflammation and the process that creates that. 99% of the time, this conjunctivitis or pink eye is from a virus. What makes it hard is that we can't treat viruses with an antibiotic because they're not bacterial. And remember, antibiotics are for bacterial illnesses. So oftentimes treatment for pink eye or conjunctivitis is confusing because you will oftentimes see drops ordered for the eyes. Now, typically when we have a patient come in that the parents are concerned with pink eye, and generally we know that pink eye can spread, but truly it's the viral illness that spreads, not just the pink eye. If you spread a virus that causes pink eye to somebody else, they may very well get that same symptom. Eyes have secretions, and oftentimes with conjunctivitis, we get secretions that can be a little yellow, a little more significant than typical, and crusty. And as we touch those areas of drainage from that eye, those secretions also carry that virus. So that is why pink eye is contagious, because you do get the dripping from the eyes that can unfortunately hold the viral particles with it. So if somebody wipes their eye and they actually touch somebody else at a mucous membrane area particularly, that person can get that virus much easier than if they didn't have that drainage at that eye area. So the confusion is when do we order drops for kids? And it's confusing because daycares will oftentimes tell families that you need to get this pink eye treated or you can't bring your child to daycare. Now, the treatment is actually time, and that's what makes it very challenging. Because the majority of pink eye is viral, what we try to do is really look at the most severe cases of pink eye as being the ones that we would like to consider treatment for. It's almost more prophylactic to prevent bacterial infections. When you do get a significant inflammatory region of your body, it does always put you at a little bit more risk for bacteria to unfortunately take hold. So with pink eye, what I typically do is look at it in different degrees. And if a child has mild to moderate pink eye symptoms, I always try to tell the family that this is viral, that you can transfer that virus to another person through those secretions of the eye, but that unfortunately drops aren't really going to help that. So what happens is sometimes we have to write a note to the daycare that says they do have pink eye, and it will require some time to resolve. Oftentimes daycares will allow families to go back in within 24 hours if they do have drops written on board. As we all know that it's difficult to have a child out of daycare for a significantly long period of time while we're trying to heal these symptoms, what I try to do is make sure that I educate the parents first, allow them to write a note, allow myself to give a note to them or my staff to write that note so the daycare understands that this is something that is viral. And if the daycare will allow them back in as symptoms are getting improved, such as no fevers for 24 hours without medication or significant decrease in the pink eye drainage, then that's something I try to allow the daycares and the parents to work through together. If pink eye is something that's got a significant amount of drainage and discomfort, and you even have mild swelling around the eyelids, I will order a medication such as drops for those eyes, because those are the ones that are more at risk. And instead of taking a chance, particularly in our infants and our littlest kids, I will order drops that are antibiotic drops for those eyes. What happens if we order drops for kids that we feel are really more mild to moderate, it's making it more easy to transfer that viral illness to other people when they're allowed to go back to daycare too soon. Viruses unfortunately can survive, for a few days in our body before our body can really fight them. Once fever's clear, we know that the virus is on its way out. Once our symptoms start to clear, we know that virus is on its way out too. So being smart about pink eye is really what I'm asking families. Don't rely on just antibiotic drops to take care of it. If your child is really having significant eye symptoms, remember they're contagious until the child is having fevers for greater than 24 hours. If you're looking at fevers that are something that can be brought down with medication but continue on for the next day, you want to keep them home. You never want to have a child attend school or daycare when they are actively having fevers. You want them to be fever-free for 24 hours without medication before you even consider sending them back to school or daycare. And that way we'll be less likely to allow any viruses to transfer to other people. With the fall coming here and the winter months following, it's really important that we all try very hard to understand how these viruses work. And understanding pink eye in general is a great way that I use to educate families and schools and daycares about the viral transmission and about how we really need time to improve them. For anybody that does take care of children with pink eye, what I do is I tell them to wash their hands after they handle the child, especially if they are around their eye secretions. Their first instinct is to wipe those eyes, wipe the crusts away, wipe the drainage away. And after we do that, we really should always make sure that we wash our hands. That way we're less likely to transfer that viral illness to anybody else. I think those are the most important points I wanted to discuss at this time. Again, please make sure reach out to your pediatricians for any questions or concerns. Remember that drops can be ordered in ways that are not always appropriate, and that we don't want to rely on those drops to no longer transfer that viral illness to others. If we send our kids back and they're having significant drainage, even though they're on drops, remember, we can still transmit that virus to others. So do what you can to be smart about your child, decreasing the possibility of transmitting any viral illnesses to others, particularly for the younger kids. The infants are ones that have not been around as many viruses as the older kids, so make sure you keep in contact with your pediatrician so you are not guessing about what to do, what to use for care, and when to keep them out of daycare and school. I hope everybody has a great night. Thank you for tuning in. Have a great day.